My name is Dr. Rachel Vreeman. I am the chair of the Department of Global Health and Health System Design at Mount Sinai. And I also, in that capacity, am the director of the Arnhold Institute for Global Health at Mount Sinai as well. I'm a pediatrician by training. I do HIV-related research and work primarily with adolescents and their families in sub-Saharan Africa, looking at ways to provide long-term support for HIV care. As many of you who have joined us before know, we are delighted as the Arnhold Institute for Global Health and the Department of Global Health and Health System Design here at Mount Sinai to be hosting this series of remote events where we get to examine issues in the COVID-19 pandemic from a variety of viewpoints, including with a global lens, but also looking across various aspects of the healthcare system. I'm delighted today to have two panelists with us who are going to give us not only a sense into the nursing perspective on this pandemic, but are speaking from really high leadership positions where they can help us to understand how the nurse role and perspective in this from both an immediate and bedside perspective plays in, but also at a high level within their integral role in health systems and as we think about a workforce within healthcare. I'd like to note for everyone joining us that we will take questions towards the end of this hour. And if you want to submit a question, there's a Q&A box that should be at the bottom of your screen where you can type questions at any time. And when we reach the end of the hour, the last 15 minutes or so, we'll turn to some of those questions. In the meantime, I'm going to ask some questions to start off our discussion as we go here. So let me introduce our panelists. As I said, I'm really excited to be able to talk with this group that we have here today. First, we have Dr. Natalia Sinius, who is the Senior Vice President and System Chief Nurse Executive at the New York City Health and Hospital System. Dr. Sinius began her nursing career as a nurse in the neurosurgical intensive care unit. She then worked as a quality management specialist and became a patient care director for neurosurgery and the neurosurgical intensive care unit at Columbia University's Medical Center and the New York Presbyterian Hospital. She served as a senior director of nursing and deputy chief nursing officer at Mount Sinai St. Luke's. And now in her role at New York City Health and Hospitals, as I said, she's a senior vice president and system chief where she leads over 9,000 nurses to serve 1 million New Yorkers through the New York City Health and Hospital System. Her training includes a doctorate in nursing practice from the George Washington University, a Master's of Science in Management, and a Bachelor's of Science from New York University, and a Bachelor of Arts degree in psychology from the Stony Brook University. As it happens, Dr. Sinius, among her many qualifications, which I could keep talking about, also has international experience and also too related to HIV and AIDS with a number of international talks and work related to outcomes from both hospital-based and pathophysiology of AIDS that she shared. She's currently a fellow of the New York Academy of Medicine and a board member at the Center for Healthcare Innovation. So welcome, Dr. Sinius. And also joining us today, we have Dr. Todd Ambrosia. Dr. Ambrosia is the Dean of the Phillips School of Nursing at Mount Sinai Beth Israel. He's a distinguished fellow of the National Academies of Practice and a Bravewell Fellow in Integrative Medicine. And he actually was recently selected as a Wharton Executive Leadership Fellow by the American Association of Colleges of Nursing. His academic healthcare career has spanned more than 20 years as well, devoting himself to nursing early on with a role as a director of the Division of Family Primary Care and assistant professor at the University of Maryland School of Nursing. He has research and clinical interest in integrative medicine with fellowship training at the University of Arizona School of Medicine, and he's a board certified family nurse practitioner. He continues to be active in work related to adolescents and young adults care as well. and has served as a faculty ambassador to the National Health Services Corps in the U.S. Department of Health and Human Services. Dr. Ambrosia, Dean Ambrosia's expertise also includes global health work, including clinical research and academic collaborations with universities in Taiwan, Colombia, Belgium, India, and Malaysia. So I'm really excited to have both of you here today, as I said, to think both from a leadership and systems perspective, as well as a specific nursing perspective, and where we can to consider the global ramifications of this pandemic, even beyond our very immediate, very intense impact that obviously we're all grappling with here in New York City as well. So I'm going to start with a general question to both of you. We'll give you each a chance to answer. I would love for each of you to start with sharing a bit about how your respective organizations and the patients that you serve through the work that you're doing have been impacted by COVID-19, and particularly how this pandemic has altered the ways in which your work is being carried out, right now and over this last month. Dr. Sanias, if you don't mind me, we'll start with you and then move to Dr. Ambrosia.
Sure. Good afternoon, and thank you for having me. This is a pleasure. So I would say the major factors that changed included the makeup of our facilities and the onboarding processes for nursing. New York City Health and Hospitals is the largest public health system in the United States. We provide essential inpatient, outpatient, and home-based services, as you mentioned, to more than 1 million New Yorkers every year in more than 70 locations across the city's 5 boroughs. We have 11 acute care facilities, 5 post-acute care, long-term care facilities, Gotham Health, our network of federally qualified health centers across the 5 boroughs, corrections, and community care. We are extremely proud of how well our healthcare heroes across the New York City's 5 boroughs performed during this crisis. All New York City Health and Hospitals facilities began preparing, and I would say January and February of this year for this surge. Following Governor Cuomo's directive in late March, our facilities began providing specific plans to increase total bed capacity by at least 50%. We went from 325 bed capacity to approximately 1,500 ICU beds. And so you could just imagine the magnitude. In addition to increasing our capacity, we transferred patients and resources within our system. The Office of Patient-Centered Care, which is my office, Central Nursing Office, reached out to a broad spectrum of nursing agencies, local universities, volunteer organizations, and recently retired nurses to really develop a database of nurses and nursing specialists, including respiratory therapists, hemodialysis nurses, critical care, and med-surg nurses for recruitment and deployment during this crisis. My office, the Office of Patient-Centered Care, essentially, really had to partner with human resources, IT, and occupational health services to create what we call is a virtual deployment team, which allowed us to really fast track credential processes for our nurses. And we developed a virtual deployment orientation program. And that allowed us to onboard our nurses within 2 days versus 4 weeks. And so we saw a major change in the landscape of our facilities and also the way in which we were able to deploy our nurses. And so everything changed within literally a matter of days.
Wow, that is an incredibly responsive and I would say, efficient shift for such a massive burden of work and organization. Incredible. Dr. Ambrosia, would you like to talk about this from the perspective of the School of Nursing?
Right.
There's plenty we can dig into.
Absolutely, as I have a unique perspective because I sit as a dean in a major healthcare system. So I have 2 different lenses. I have an academic as well as a clinical lens. And looking at now through the lens of being part of the health system, of course, we've had to leave our familiar day-to-day behind, preparing for an ever-evolving new day-to-day. Increased census, expand our care units, enhancing our nursing workforce, as Dr. Sinaias had mentioned. Absolutely, to maintain that excellent level of care that we provide to our patients, but also looking at becoming accustomed to that new normal, or evolving new normal. Again, our patients have as well had to adapt, because oftentimes they're presenting for care now alone, and in their care process are also alone. So that's changed the face of nursing care, and nursing environments in that care have changed as well. The fluid environment of the nursing unit has changed to the point where we have a more prescribed, circumscribed area that we have to stay within, in terms of maintaining social distancing and other measures. Technology itself has impacted the way we practice, both to distance us and connect us, both with each other and with patients. So we're utilizing technology more fully in the care process. And that is, as well as I said, connecting us. We're having our meetings. A lot of times our huddle meetings are done remotely on Zoom. We're doing a lot of Zooming lately, Zooming in, Zooming out. And inherent to being nurses wearing capes, that's pretty appropriate as, you know, we move through the process. But, you know, we are involved in telemedicine, telehealth, using our assessment skills and diagnostic skills through that telemedicine, telehealth, trying to provide counseling and education to our patients in a different venue. And I think another change would be working behind the PPE, the personal protective equipment, all the time. That's different for many nurses. So I think those are some of the challenges that we've managed as nurses in a nursing team in our environment.
Sure. You know, I think it's, first of all, again, thank you so much for spending this time with us. It's already, you know, so clear the expertise that you bring to training, support, management of nurses throughout these big healthcare systems and in this city and beyond. I wondered if we could dig down a little bit to help paint a picture further for our audience about the essential role that nurses play within different parts of the pandemic response. You know, I think Dr. Sinius, and even what you were describing across the various specialties of nursing and thinking about credentialing, I think many people, many of us may forget, you know, the very diverse roles that people are maintaining in different specialty areas and across this response. Now, I recognize we don't have time to go into detail about all of that, but maybe you could each help us understand a little bit more some of the broad picture of the types of roles that nurses are playing within the healthcare systems and the even greater demands on them. And even, you know, thinking of the PPE demand and what that, you know, does to our ability to communicate and provide care and so on. But maybe giving just fleshing out a little bit more of the stories of what kind of work nurses are doing within different parts of the health system right now.
If I can start, I will. Basically, I think, you know, when I consider essential aspects of nursing as it applies to the COVID pandemic, I think they're a bit different than what Florence Nightingale may have envisioned in my nursing theory instructors might have considered as aspects or essentials of nursing, but I think they're appropriate and apply here. I think advocacy for both the patient and each other. I think there's an opportunity for that advocacy to come through, to be able to manage patients, manage each other, and help each other through the day-to-day. Resiliency. I see a lot of that with this ever-changing landscape, moving between several scenarios in the span of minutes, whether it be a particular situation in admitting a patient to the unit, possibly even dealing with an end-of-life issue within a very short period of time. Teamwork, working with all members of the team and managing that to engage everyone in that healthcare team, in that care process. I think the fact of knowing, just having that inherent knowing to know in all senses when you need help, when a patient needs help, and potentially when another nurse needs help, and to manage that knowing to help you move forward with improving outcomes. And two other issues, you know, the self-care that nurses need to adhere to and manage, especially as they're dealing with some of these high intensity moments. And accepting the fact that compassion fatigue is very real and managing that with appropriate outlets. Because we do find ourselves providing compassion at every moment that we can in terms of our provision of care. And we get a burnout in that regard. So we have to keep that moving and alive and find some mechanisms to move that forward. I think that with the increased demand, nurses being the largest critical mass in any healthcare organization, and likely with globally in terms of the mass, we have to consider those roles that exist beyond the bedside. There are areas that we consider nursing: ICU, cardiac, pediatrics. But then we also have education, we have informatics, we have research and public health. And virtually all areas have been pressed in terms of an increased call to duty, if you will, as well as the increased need for human power within their respective specialties. So that in itself is a layer that we're not particularly used to in our normal day-to-day. Some nurses have been redeployed into areas, as we at the School of Nursing have, to provide frontline support, which takes us out of our normal day-to-day role. And we've been challenged to adapt to nursing practice that's changing based on new evidence, because evidence drives our practice. And if the evidence is changing, of course, our practice and interventions need to change in step with that. And I'm very proud of the nurses rising to that opportunity and the challenge and the outcomes that we're seeing.
And I would say I completely agree with you. You mentioned teamwork. I really saw that. And also at New York City Health and Hospitals, we're so large that I was able to literally see the impact of COVID-19 in all different areas: corrections, community, going into someone's home, making sure that that nurse has PPE because that patient may be positive in the home, whether or not it was in an inpatient unit, really redeploying our ambulatory nurses, as you just mentioned, into the inpatient area. So it really allowed us to really become more specific as it comes to clinical expertise. We needed to really hone in on our nursing assessments in a very focused and specific way to really assess our patients in an expeditious manner. For example, in our emergency department, I remember getting a phone call from our chief quality officer who needed nurses to simply monitor oxygen saturation in a crowded emergency department, because that's the exact number we needed to monitor, for these patients. And so really going back to the basics within our nursing assessments, our focused assessments for respiratory arrest, and working, on teams, really task-based nurses, training our nurses, our med-surg nurses, to function in an ICU capacity. So, these are the details and the nuances that we really had to capture in our training and to support our staff to really manage this disease. It was really intense, and it still is.
Yeah. I think absolutely that intensity of having to make these shifts, having to develop expertise in a situation where we don't actually, this is a novel virus that we haven't had expertise about how to treat, so you're both, experiencing those shifts in terms of maybe your work environment with redeployment or how you can interact with patients. And then on top of it, constantly adapting to what we're learning every day about how, what makes sense in managing this infection especially. And of course, doing that with however many times more patients than you would normally be taking care of at that time as well. It's just an incredible challenge in that regard. I want, I guess, shifting a little bit, but continuing this, we keep asking and trying to think together, and with a goal of moving towards action, but about how this pandemic is disproportionately affecting vulnerable groups of people, and across multiple vulnerabilities. But I'd love to talk with each of you about that more in terms of what you're seeing from your perspective, and also just what you're most concerned about when you think about the numbers you're seeing or what your workforces are dealing with. Dr. Simias, I know you've emphasized inclusivity and the importance of education and prevention throughout your work. Do you have any ideas, not only what this looks like now, but as we think about underserved groups moving forward in this, what we might be able to tackle related to prevention or education, or anything you see from the midst of these major challenges that we could start trying to work
Yeah,
with?
I've really been humbled by, this experience. I received a call from a friend of mine who's a lawyer, and she plays a leadership role in a community-based organization. And she called me because there was so much she didn't know as a leader within the community. And so I then set up a call with experts within our systems for testing and also ambulatory care to explain where testing is happening. And, at that moment, I realized how much education is really necessary. So when we talk about vulnerable groups, we really talk about the patients we serve at New York City Health and Hospitals. I think trust and knowledge are both key. We are partnering with local churches, educators, community leaders to really build trust among these populations. Just this week, I've seen so many posts, on my social media feed about Tuskegee come up, and I was shocked because it really brings us back to our history, particularly in the Black community. And so I think it's really important that we build bridges to these communities to ensure that they receive accurate information and to make sure they have all the access of resources within our healthcare system. More research is needed to really identify the unique healthcare issues and concerns facing these imperiled communities. And so it's so important that we do our best to provide them with information. Our goal within New York City Health and Hospitals is to ensure that patients receive humane care with dignity and respect. Our diverse workforce comprises of more than 40,000 employees. And so our goal is to ensure that within every patient encounter, we treat all patients the same. But I must tell you, when we started seeing our patients come into our emergency departments, we were shocked because it was not what we expected. As you remember, initially, we thought it was the elderly. And I remember walking into the emergency department at Elmhurst and seeing patients of all ages and seeing minorities, literally waiting online to seek care. And so when we think about the statistics and what they're showing as it relates to minority populations and how they're disproportionately affected by COVID-19, with factors such as, diabetes, high blood pressure, lung cancer, and strokes, it's very concerning. But I think we're going to have to, again, really reach out to the communities, educate those, and we might even have to educate those who are educated. And so I think everyone needs education because there's so much we do not know about COVID-19, even today.
Sure. And I think it is, just as you point out, such a challenge when first of all, seeing, just as you described, how, the ongoing severe impacts of systemic racism and disparities create such vulnerabilities in people's bodies that they're being, that communities are being so devastated by this virus. And then at the same time, because of the issues that are there with those injustices, trying to also not only figure out how to best provide care, but then how to better communicate, build relationships where education and information can be shared in ways that can help as well. It's like just see these layers of challenges in that. But I think just as you described, the relationship building, community engagement, being so connected with populations across the board in that way are really critical. And agree that we have such unanswered questions as well in terms of what we specifically can try to address. Dean Ambrosia, would you like to add to that? And I know also too, we share a commonality of working with adolescents in a different way. I'd be happy to talk about what you see in terms of the impact of this pandemic and the social distancing and lockdown and so on adolescents as well.
So picking up on what Dr. Sinia said, it is that education piece. I believe education is the foundation of helping us to move forward. But in adolescence, you have a challenge because they are typically the contrary, obstinate types at certain points when you try to provide them information or guidance and advice. they take risks inherently based on age. And I'll specifically look at what I see in young men's health, because that's one of the areas that I focus on in my practice. I'll take it in two parts, and I'll be brief, but I want to address the illness piece, because actually men are disproportionately affected by COVID more than women, about 55 to 45%. Not exact, but very close. And also men tend to have a lot poorer outcomes when it comes to dealing with COVID as it evolves as an illness. And bringing that to the point where we're engaging young men or youth, they have that increased risk-taking behavior coupled with misperceptions, as Dr. Sinia said. This is a disease of the elderly, the disease of the infirm. When we are seeing much younger people affected, and affected severely depending on the presentation and the symptomatology, we also have that giving them that false sense of security. So what happens is they reduce their social distancing, they reduce their self-cares, basically what we consider as frequently as we'd like them to, puts them at a greater risk to become infected, and that in turn puts them at a greater risk of infecting others based on that, attitude. Again, I haven't seen much education or public service addressing this population, teens, adolescents in general, to address it directed toward them to understand, especially use of color. There are properties in relation to all of the subpopulations that fall into youth. But we need to appeal to them through their genre, music, sports, peer recognition. And then when we flip to the whole social measures impact, we look at, teens are inherently social beings. They thrive on their peer acceptance and recognition. So the impacts of this, cities on pause and our sheltering in place, have really affected their ability to socialize and maintain those connections that are so important to them. So then they get these feelings of isolation. And, as we all pretty much have felt at certain points, depending on where we were at that particular time, you get that increased risk of either developing or exacerbating existing anxiety, existing depression, and other mental health issues may emerge at that time because, it's just the intensity of the situation. As well, parents need to be able to recognize, parents and significant others, depending on their living situation, need to observe for these potential signs of distress and be able to connect them with resources. But to connect them with resources, they need to have adequate education as well. So I think we need to appeal more to the parent significant other population there. And in that environment of isolation, whoever is responsible for the day-to-day, provide a structured environment with daily expectations and participation in planned activities, have an opportunity to engage in a safe, controlled outside environment, outside the home, possibly within the confine of the yard or whatever might be available to that particular family, and avoid the constant video games, social media, cell phone use that we're all prone to, but also being aware of them potentially being AWOL, especially at night, sneaking out, doing what they shouldn't be, and especially at times when they're not supervised.
Sure. This is secretly, I guess, a highlight. We're actually going to talk in this series next week about adolescents, particularly, and focus on adolescent health, including not only with some additional New York experts, but with a colleague of mine from Kenya who leads the adolescent health program across Western Kenya. So if you're listening to this and you're interested in thinking about these issues of adolescents and young adults, I encourage people to also join us next week. We can't talk about it too much in my mind as well. So really happy to hear that. And that's, I think, really helpful practical advice too, thinking about, members of our families and people we know, and also as clinicians, how we, consider risks and talk with families and support them at all ages in this. I guess and one additional follow-up question with this, as you're mentoring nurses, but also as you're training up and positioning your nursing workforces, what are the key values in this that you're trying to kind of build in or portray when it comes to addressing vulnerable and marginalized populations as they're also in the midst of these, intense pandemic demands as well. I think you've mentioned some, but I'd love to hear it again in kind of a summary of where your key values or principles that you're trying to bring forward in the work that your nursing teams are doing.
Sure. So I am proud, so proud of the 9,600 nurses within our facilities who come to work every day and exhibit our values. So our values at New York City Health and Hospitals are ICARE. And ICARE stands for integrity, compassion, accountability, respect, and excellence. Throughout all of our educational and training materials, we emphasize that every person is entitled to have their basic human needs met, regardless of identity, place of residence, and health. And so providing care that demonstrates our values and respecting all and being sensitive to their needs, whether it's the use of interpreter services, social or financial needs, needs to be the same across the board for all of our patients. And so I model that as Chief Nurse Executive, and I implore all of my mentees and all of our nurses to exhibit those characteristics. And so throughout this crisis, we have made it a point to really highlight our values and to continue displaying, whether it's integrity, compassion, accountability, respect, or excellence daily on our intranet and on our social media feeds, because that's what really grounds us to ensure that all of our patients receive care that is really tied to our mission at New York City Health and Hospitals.
Sure. Dean Ambrosia, would you like
So
to add?
that, as a dean, I have a unique opportunity to mentor both faculty and nurses, new nurses, actually, students, before their entry to practice. And in both respects, I think it's, as Dr. Cinia says, very important to role model. So when I'm managing a group of mentees or an opportunity to engage in faculty development, I often facilitate my sort of genre of principles by doing rather than preaching, because I find that by doing, you can model that inclusiveness. You can live the actual concept of leaving the biases behind. And in doing that, I think you actually even impact your unconscious biases as well, and leaving, I think, a greater, longer lasting impression, because I provide care consistently, as Dr. Cinia said, across the board to all my patients. I expect that of my nurses, my nursing faculty, and my students. But when they see we're caring consistently, not for a particular person or a group, not their wealth or status or their particular illness per se, but we're caring for that person, I think everything comes into focus. And once they realize that is a lens that I want them to retain for the remainder of their career. And it's really amazing to see.
Thank you both for that. So let's shift our perspective a little bit. Within this webinar platform, we are trying to bring a global focus to our discussion about the COVID-19 pandemic. Again, recognizing that global is also very much here right now in New York City as we deal with this pandemic here. But I know that both of you have a broader global perspective on health and nursing care and so on as well. So I'd love to hear more from your perspectives about how schools of nursing, nurses within global health systems in other places are addressing this pandemic also, not only in how they're caring for patients and shifting health systems too, but also as they try to prevent infections from spreading, and the workforces operate in different ways depending on what's happening in different places as well. Maybe we'll start, Dean Ambrosia, with you this time with what you're hearing from international partners or any global perspective into how this pandemic impact is being addressed or being felt in other places as well.
Okay, it's interesting because my closest partnerships and collaborations now are with universities and health organizations in Taiwan, which, as you know, has maintained a really tight control of the situation next to Vietnam in terms of their outcomes and infections. They have less than 500 confirmed cases. They have about less than 10 deaths overall, and reporting less than 400 recoveries at this. So I think we're looking at a really good model to go by when we consider what are we doing right? instead of focusing on some of the other. And I thought it would be a good idea to talk about this today, because I think this is what we're moving toward here in the US. You know, they're very proud of the fact that their government supported like this 4-point approach. They have that effective border control, proactive case finding and containment, allocated resources effectively, and essentially provided that very strong reassurance and education to their public. I think that's an important component. Early on, before this even became an issue, they instituted these measures. Nurses, of course, are involved because they're managing that COVID impact by engaging in these public health efforts. They evaluate people at points of entry. They track infections. They provide community education, testing, managing containment during the illness situations in epidemic clinics and units and hospitals specially designated for COVID. They're proud of the fact, too, because they're able to manage their non-COVID patients effectively within their healthcare system. So that's something that, you know, we've talked about. Their healthcare system, of course, hasn't been impacted the way we have here in the United States, and most countries have. But nursing as a whole has still engaged in being prepared and preparing. So they expect the worst and actually hope for the best. And they left me with one very important statement when I had the conversation. Said, prevention is better than cure, especially when there is no cure. So I think that was an interesting thought to think about.
Sure, absolutely. And after, you know, someone who's worked in the HIV epidemic for a long time, that certainly rings true to me from that standpoint in terms of, you know, what we've learned to be able to do from the early days through now in terms of managing HIV as a chronic disease. Not obviously, COVID is a bit of a different virus, but still the principle of prevention in that, and the critical role for public health measures and some of those things you're talking about. Dr. Simios, any, I guess, sort of things that you're seeing, or even too, as you think about lessons from this crisis that you would hope to impart for clinicians and systems in other global settings, perhaps especially other public health systems or places where there may be limited resources?
Sure. So I think a global perspective is imperative. Since the beginning of this crisis, all of our leaders have been in communication with global colleagues. For example, in February, our Critical Care Council had discussions with colleagues in Italy and to learn how to care for the surge of patients. And those conversations were critical in ensuring that we were ready and really were, I think, bracing for impact. Talking to them allowed us to learn from their experience and quickly ramp up our efforts to meet the unique challenges presented by COVID-19. Similarly, we are now sharing knowledge and experience with our colleagues in other countries. As you know, every year my hobby is international conferences. And so I've been in touch with one of my associates in Ghana, and she shared information about setting up her emergency operating committees and the work that she's doing as it relates to midwifery and also nursing prevention. She also completed and developed a COVID-19 training plan for her nurses. And right now is doing the same thing we're doing in New York City, which is really providing psychological support for her employees as well. So a lot of commonalities across the globe, which I found, surprising, but it's great. I think for countries, as you mentioned, in terms of advice, I would say preparation is key. Learning about what's happening across the world is very, very important. Thinking about things such as the basics, hand hygiene, social distancing, things that don't cost much, such as homeopathic remedies, really trying our best, because again, we don't know much, but we do know a lot of this are some things that we can do that does not cost much. So I think those connections are imperative as we go through this. I think the lessons learned globally allowed us to really get through the peak because of all of those lessons learned from Italy and staying connected with Ghana.
Yeah, and I think along those lines, just as we see, that the virus, of course, does not respect boundaries and borders in this way, the more we're able to share knowledge, experience as it's rapidly gathered, it's figuring out what works, what doesn't work, data along those lines. that has been the borderless solution in some ways too, or, kind of countering the ways in which the virus moves like that as well. That's really critical. I'm going to ask another question or two, but I'd like to remind people listening that if you have a question, this would be a great time to type it into our question and answer box. We're happy to take some of those as well. Another question from me, so, obviously both of you are educators and mentors in your roles. And I'm curious to hear more about how this crisis is affecting trainees and, even too thinking about people being rapidly trained up, even experienced, nurses being rapidly trained up and deployed into different settings. How has the impact of that been? And do we have ideas too for how this might shift what nursing education looks like going forward as well? Sort of lessons learned, I guess, whether difficult or good or positive for the future that way.
I'll start.
Okay.
I think as we've had to remove to a remote learning platform relatively quickly, we've been removed from our learning environments, our sim labs and our skills lab and our clinical opportunities that we have in this setting that the school provides us. Clinicals as well have gone virtual. We use artificial intelligence and artificial reality and other models and modes of a clinical venue to enhance student learning. And our opportunity to then leverage technology to enhance that education has increased exponentially. And many of my faculty have been learning as we go, because managing new technology in a new learning venue has been challenging. It's challenged us as educators. How do we restructure standard models of nursing care and bring that into a new opportunity to impart the knowledge and do it effectively? I think it will likely have an impact on how nursing education is delivered, because we have been for many years in nursing education in this mindset that it must be done this way. The students must do this and they must do that. And I think there is an opportunity for us now to keep the technology engaged, albeit we can't replace that hands-on care, but we have to be able to leverage technology to enhance that learning and also bridge the gap in such as these when we don't have the opportunity to go into the clinical setting. I think it's challenged students to be more adept in integrating that level of technology into both their didactic and clinical training, and to bring something of value to their nursing practices they provision for their entry to practice. It's placed some constraints on how we assess students, but we're working through those hurdles, working collectively with the New York State Council of Deans, the American Association of Colleges of Nursing, and separate from nursing, the Council for Independent Colleges and Universities has kept us connected to stay within the academic environment, albeit remotely. And I think that, we're going to come through this at a point where we're stronger and more effective to teach nurses and keep them engaged.
Terrific. Dr. Sinias, thoughts on adaptations and ideas for trainees and education?
Sure. So, the social distancing aspect really, I think, really led to technology being our linchpin of rapid response. Our internal competencies with technologies such as WebEx and online training and our strong partnership with our IT staff allowed us to really quickly shift to a virtual onboarding strategy. So I think trainers have to be skilled in technology. And ironically, one of the competencies for my entire team was, believe it or not, WebEx training, right? To make sure that everyone has the basic skills of setting a WebEx up. And so I think, trainers have to be skilled in technology. I think trainees need to realize that this might be the way in which they learn. The more agile people become, the faster they will transition to this new virtual realm. And I think that initially, looking back, we wanted to cancel everything, just cancel everything, cancel all meetings, but we realized we needed to shift to an online platform for many different things, because that allowed us to really stay connected. For example, our nurse residency program continued to meet with their mentors online, and that allowed them to conduct reflective learning exercises. And they articulated that continuing to meet allowed them to really deal with the emotions they were feeling as they cared for our patients during this crisis. So I think really leveraging technology is really key in all of this.
Yeah, I think it's been an incredible learning experience that way for all of us, figuring out like how this could be rapidly scaled up for all of our meetings and things.
Right.
And yet too, and at the same time, while we rapidly learn the value of that and what can be done, and as you said, how it I think is a kind of a lifeline when we're dealing with stressful things and distance, to have at least some connection to other people in that way as well. And at the same time, it makes it clear to us the things that cannot be replaced by in terms of human contact, and where we, absolutely do still have needs for, for face-to-face, for hands-on, for direct patient care, for all those things that we can't do, as well, but it helps us figure out some of that. It's been, though none of us would have chosen this push into that, I think it has been a rapid learning experience that way. I'd love to hear, and I think starting with you, Dr. Sinius, about our new normal in terms of the current situation. I know, thinking about our cases, it's almost funny, I think in most of our hospital systems we're feeling, oh my goodness, it's so much better, things are so much improved, and yet individual hospital censuses are still have, for example, as many patients as Taiwan has experienced in this entire pandemic or something. That seems great to us. So, and I don't mean to make light of that. It's just the ways, that our volumes have expectations have shifted. So could you maybe tell us a bit about how care delivery is beginning to return to something closer to a new normal, what that looks like? In fact, I see, a question coming up about, when are surgeries going to start to be resumed across the health system? What kind of services are starting to open up? What is this new normal going to look like for the system?
Right. And so we started those conversations approximately 2 weeks ago, really going back to opening up our ORs and cases, and all of the facilities have started to execute those plans. In recent weeks, management and staff throughout the system have been dedicating more attention to medium and long range planning. The overriding priorities are to learn from our successes and challenges in this crisis, to play a meaningful role in the broader public health domain, and also really taking a look at what care our long-term COVID-19 patients will need. So ensuring we have those services in place, safely opening up spaces for non-COVID patients, as was mentioned earlier on the call, and making sure that, we have enough hemodialysis nurses and peritoneal dialysis supplies to ensure that we can care for those patients. I think there was an article that came out just today that says like 36% of patients who were COVID positive, require some type of dialysis assistance. And so ensuring that we have all of those mechanisms in place to care for our patients. So we're focusing on right now also expanding our testing capacity. Right now, testing and tracing in New York City Health and Hospitals is key in the new norm, and making sure that everyone has the opportunity to be tested. And so nursing is front and center in this strategy. And so we're really looking forward to really taking the lead on that with our ambulatory care partners. And so really helping monitor, helping isolate patients in hotels. We're really focused on that. So again, a lot of long-term care planning, making sure we have enough beds. Still, to your point, making sure that we still have the beds in long-term care to really care for these patients, and making sure that we have the services in place. But opening up ORs has already started. And so we're really in full gear to care for our COVID positive patients, and opening up our services for non-COVID patients as well.
Sure. Thank you.
You're welcome.
Dean Ambrosia, for the Mount Sinai Health System, can you talk a little bit about what that's starting to look like?
I would agree, and it's much along the lines of Dr. Sinias's comments. It's my understanding, of course, as she said, we're not there yet, but we're actively planning for it. engaging in a stepwise approach, a graduated approach to get us to the point where in a new normal in terms of operations. I think developing the plans to manage COVID and non-COVID patients within the same hospital, if you will. And I think this is where engaged nursing research comes into play, because it's really having an impact on best practices. So when you consider all of what's being done, the nursing research piece of that really plays out here to talk about how we can manage some of these situations with infection control and improving patient outcomes. And I think, you know, the planning to return to normal operations in certain service lines that haven't been operational during the crisis, you know, that's all in the active planning stages, as well maintaining our ability to respond to potential unexpected change as COVID emerges continually in the community. I think as well, the most concerning issue that most colleagues are voicing is that uncertainty. You know, with us moving forward, it's that uncertainty piece that's sort of the cloud on an ongoing basis. But I think we're optimistic to the point where we're moving in the right direction. Things are looking much better.
Sure. I'm so glad that you brought up the important role of nurses in research going forward. You know, I do think that that's a critical thing to consider, and that, you know, be happy to hear more about from your perspective as well, Dr. Sanias, in the sense of why it is so critical to have nurses integrally involved with leading research and asking key questions for what needs to happen next in our strategies, whether for infection control, for treatment, for how we connect with communities, and so on. I think that's a really critical point in there that I don't want us to miss as well. Would you like to say anything about that as well, Dr.
Sure. I think it's vitally important that nurses tell our story to impart the lessons learned, such as best practices and the care that we've provided in the middle of this crisis. We all recognize that this is history in the making. As we just concluded Nurses Week, you know, celebrating Florence Nightingale's 200th birthday, this pandemic will be read in textbooks 200 years from now. And so it's so important that we really, you know, have a voice in the research that is being done. And so at New York City Health and Hospitals, we have an amazing interdisciplinary research committee where nurses are leading different committees and making sure that we have a voice, because it's so important to share this information with nurses across the country.
Sure. Sure. And we've been moving through some of the questions or parts of it that we have here, so I appreciate that as well. You know, I think a question that's here that I think is an interesting one, I'll kind of tie two of them together. You know, though we're seeing deaths and hospitalizations with COVID-19 thankfully going down, I think we're all recognizing and commenting on the fact that we do know that this will likely be around for a while as things reopen. We worry, of course, about a second wave on the horizon. And also even thinking about, you know, what happens when we have the flu season on top of this in a way that we did not as much with the timing of when this pandemic emerged for the United States. So there's a question in like thinking about those trends, and as we in this kind of middle to longer term phase of where we're looking, how do you see the needs of nurses changing, and how can we better address those needs as we look at this, maybe especially kind of middle range that's coming up here? Be happy to have either of you open that.
Sure. So we conducted a hot wash at New York City Health and Hospitals just to talk about, you know, lessons learned. And one of the things that we came up with was just, you know, the need to over communicate. I think, you know, making sure that our frontline nurses understand, you know, what's coming down, and us vice versa, and understanding what they need. What's also imperative, I think, is to not depend on equipment and technology as well. Although it's been our linchpin, I think we have to go back to the basics, such as, you know, running medication without pumps in case you run out of pumps. And I think, you know, going back to the basics of nursing, our assessments, our focused assessments are things that we're going to have to do. And I think, you know, really understanding now that, okay, this is a specialty such as hemodialysis that we will need. We will need, you know, a number of respiratory therapists. And so now we know what we will need. And so we know how to ramp up quickly. And again, just continuously having to debrief. So we're doing that with our Council of Nurse Educators to hear from them, what can we do, just in time training. And so again, task-based learning and nursing in our ICUs, partnering ICU nurses with med-surg nurses, and creating that dynamic to care for the patient. So I think we've learned so much that we could use to leverage us all if there's a resurgence. But we're just constantly monitoring daily the numbers, you know, and using the lessons that we've learned to help us move forward.
Sure, sure. And I think, you know, I think that does make so much sense that that as rapid as it's been, there's an enormous amount that can be learned and immediately then translated into training and practice and preparation, so that we are in a very different place for a second wave or for additional waves and that. Dean Ambrosia, you had mentioned too the idea of the, you know, the anxiety that obviously there have been various causes of anxiety throughout this, but kind of a new flavor to the anxiety as we start to say, okay, what's going to come next as, you know, as things reopen, as we try to approach a new normal of some sort, as we you know, begin to change what's offered. Thoughts from your end on how we can address these shifting needs and some of that anxiety as well?
I think really we need to be able to equip our nurses with some of those self-care tools and manage those appropriately, get the information to them, provide emotional support. I know we have several support networks already in full swing in our normal operations, but now more have emerged. I think those support networks, the ability to call upon, you know, colleagues to be able to manage certain situations and manage feelings. I think to give nurses the opportunity to just show their emotions, you know, let it out, cry if you have to, laugh when you need to, you know, give yourself that space and give yourself that opportunity. And I think understand that opportunity, the need for that in your colleague. And that's that knowing piece that I was talking about.
Thank you. I think before we go here, I'd love to give each of you a brief space to say, you know, is there a message of hope that you would share with those joining us today about how we might build better health systems as a result from what we are learning right now? Something we can kind of take with us. I know there's a lot we're talking about learning, but you know, maybe a key thing that you really hope we would be taking forward into the future of how our health systems operate with us. Dr. Sinias, if you wanted to start.
Sure. So when I think of hope, I think about what I recently experienced from many different avenues. I think, you know, just thinking about nursing as a whole and how we came together. Here we are, 9,600 nurses strong at New York City Health and Hospitals, but we're so large, we needed assistance. And so we leaned on the Department of Mental Hygiene. We leaned on the Department of Education. We leaned on the Department of Defense, the Army, the Navy, the Air Force nurses coming in to help us. And we leaned on local universities and colleges, you know, and so I think this program here today really, to me, demonstrates hope. My first year as Senior Vice President, Chief Nurse Executive at New York City Health and Hospitals, one of my goals was to really connect with local universities and colleges to really break down the boundaries and the walls, because we are all nurses. And so I think this platform, I think, is hopeful, because ironically, you know, this has been my vision all year, to really partner with local universities and to really work together. And when this happened, the first phone call I made was to local universities. And so New York University, Columbia University, LIU, they all came and helped us, you know, make phone calls to our patients at home. So I think being on the panel with Dean Ambrosia is key. And I think really demonstrates the power of nurses. And it's beyond just acute care facilities. It's in homes. We are in homes. We are in, you know, in correction settings. We are in the community. We are everywhere. And I think we are a powerful force. And I think this, to me, demonstrates the power of how we can really thrive when we all work together. And so I thank you for really putting this panel together. And I think, again, this demonstrates hope in my eyes.
Thank you. Dean Ambrosia, a message from you as we think about hope?
Sure. I think, picking up on what Dr. Sinais beautifully said about how we're going to move through this and with hope. I believe throughout this whole crisis, we've been able to develop stronger professional and interprofessional relationships. I think the collaboration and collegiality among all participants in the healthcare team has really increased. I think as a body of healthcare providers, we've endured challenges that many of us couldn't even imagine, let alone have to deal with and experience, in this whole process, the loss of loved ones, the loss of colleagues and friends. At one point, I heard a colleague say something like, we just aren't used to this level of defeat. But in all of this, I think we developed a greater understanding together that we're all part of humankind, involved in an effort that's definitely much greater than any one of us. And we've grown stronger collectively. I think these factors and countless others really gave us the opportunity to be a better entity of care. We've already rebuilt the system. Ultimately this, I think, has been and will continue to improve our outcomes overall and show the power of nurses and the power of nursing. And I'd be really, it would be a real sin for me not to mention my nursing students who have volunteered throughout this crisis, provided support to the front line behind the scene in pharmacy and running specimens and making sure that they were engaged in everything they could possibly do to work through this crisis. And they did it in collaboration with the medical school, and they did it on their own. And that's what's so challenging and so awe-inspiring to me as a leader of the students and the faculty. And I'm so proud of my faculty.
Thank you so much to both of you for this. We really, I hope that this really was a chance for us to continue, kind of extend a little bit the celebration of Nurses Week, but particularly in this, not only immediate pandemic, but on this global level, the changes and collaborations and incredible daily work that nurses, that students in nursing are doing is really powerful. And I just thank you so much for your time, for your service, and for helping us to understand this more today. We are going to be posting a recording of this webinar, so you can look for that. It's usually up within 24 hours, and we'll circulate that link as well. It'll be up on YouTube. And again, next week, we're going to talk more about adolescence as well. So if you found that an interesting thing to consider, please join us as well. But again, thank you so much for your time. We really appreciate it, both of you.
Pleasure. Thank you.
Thank you.